Hi guys, today we talked about the colorectal and the stomach screening.
So welcome to Advanced Endoscopy Center in Memorial Bahcelievler.
And how it's effective for preventing cancer.
You can prevent colon cancer with 100%. Here we have a small area that will grow a polyp.
And how to choose the right clinic. What is the price? So if you don't want to live happy, long and healthy life, immediately skip this video. If you do, watch carefully till the end. Hello friends, traditionally this is Andrei Belizovsky, this is my channel Explorer, and today we talked about the screening, colorectal screening and stomach screening. I have so many questions on my YouTube channel about this procedure, how to choose the right doctor, how to choose the clinic, how to choose the country. Because when you have symptoms already or some pain already, I think the procedure a little bit more focus on these symptoms, but without any symptoms, it's too important to choose right doctor. Do not miss any future things that could cause a colorectal or stomach cancer. Today we are in Turkey in Memorial Clinic as usual, because I think it's the best clinic in Turkey, in one of the best worldwide. We already made so many films and rolics about the screening with questions, with I do it myself, but I think when we feel about the stuff that can prevent cancer, it's never too much. So today we are in Turkey in Memorial Hospital with the best doctor, who made screening up to 20 procedures per day.
Well, there are some diseases in human beings that can be prevented, and in the beginning of this one comes the stomach cancer and colon cancer. So even though if you have no complaint, if you screen these organs by endoscopy and colonoscopy by several interval years, you can easily detect some polyps and some innocent tissues that can grow into cancer in the future, so that you can find those polyps or those tissues and remove them when the patient is still sleeping and save the patient from growing a future cancer. We advise everyone after 45 years old to have colonoscopy in every 5 years time. If you have any family history of cancer, of course you need to make the colonoscopy a lot more earlier than 45 years old. You can prevent colon cancer with 100% with on-time screening.
100%?
Yep. Well, why don't people do it?
Yeah,
people are first of all afraid of the procedure because they think that they will be live and they will be feeling everything. That's the most important thing. Here in Memorial Bahcelievler Advanced Endoscopy Center, we give sedation to every patient. So there is a very funny conversation between me and patients after the procedure. So I go and ask them, how was the procedure? They tell me that I don't remember anything. And my answer is, okay, this is the correct answer. Because they don't feel anything, they don't remember anything, not at all, no pain, but lots of gain. Okay, the endoscopy normally takes 7 to 8 minutes time, and the colonoscopy takes around 15 minutes time. But if you find any polyp, so its removal takes normally for each polyp around 4 or 5 minutes time.
It depends on the size.
Yeah, that's it. So this is endoscopy. We are seeing the stomach here. I may wash the inner part of stomach to see tissues better. And you know, Andrei, most of my patients nowadays are coming because of the complaint of reflux. So your people call it ijoga. Yeah. So in the past, these patients were really helpless. Most of them were going to surgery. But nowadays, we know that this continuous reflux, continuous ijoga turns into lower esophageal cancer in future. So by endoscopic ways, we have now chance to fix upper part of stomach, the muscle between the esophagus and stomach with laser technology. This is the entrance part of stomach. So we are looking from below, and this is the esophagus over there. So in fact, this part should hold the scope like this, strong. But this is too weak. That's why we know that this patient, we already know that, by the way, this patient has reflux, that ijoga, because it leaks from here to esophagus. So when he wakes up, we will tell him about our diagnosis, and we will ask him to make him an endoscopic reflux treatment to help him to have a better quality of life, also a lower chance of future esophageal cancer. Why Turkey? Because Turkish medicine has proven itself, especially in this pandemic. So we are giving medicine education in Turkey for centuries. So we have showed that we are good enough, in fact one of the best ones in the world, to give medical services both in good quality, also in good hospitality as well. Why Memorial? Because Memorial is to me the best hospital chain in Turkey, and Memorial especially follows international rules and international certificates, so that we are sure that we are giving the service here in high quality. And now we will not find anything dangerous, but we will anyway take our routine biopsies to be sure that pathologically, if the patient has any Helicobacter pylori bacteria or not.
Where's the result of biopsies ready?
Well, it comes back in 3 to 5 days time.
Generally, patient waiting for the result or come back?
They may wait, or otherwise they all have our emails. We inform them with emails, also with some FaceTime calls with the translator, so that we want them to feel comfortable. Well, for screening, in fact for endoscopy, just coming fasting, do not eating anything after midnight is enough. So we perform normal procedures in the early in the morning. But for colonoscopy, of course, all of our bowels are full of stool. Mine, yours, and the patient's as well. So we give them some medication the day before, half a day, to make them diarrhea and empty the bowels. Then our patients come here to some VIP rooms with their own bathroom here, and our nurses perform them some very small, tiny enemas, and your people call them klizma, some klizmas. And as soon as we see that the patients are clearly ready, the colon is all empty, then we take the patients to the procedure. We find polyps generally because we are using artificial intelligence here.
You're using it? Yeah.
Our polyp detection rates are a lot more better. So in 1/3 patients we can find polyps.
1/3.
It's the most important thing to me, because so these procedures are equipment dependent and that operator dependent. So you have to get, for the best efficacy, you need to have the best equipment with latest technology. As you saw, we can even screen with artificial intelligence. You need to have a good operator with good experience, with lots of operations done, to be sure that the eye, when the eye sees, it recognizes what it sees. Okay, so you know, seeing and looking are something different. So you need to know what you are looking at.
Okay, how you evaluate the impact of your routine work? Maybe in percentage. It's interesting.
Well, to be honest, it does not add that much right now. But when I put my head to pillow at night, so I am sure that I would not miss anything, because even though I had missed it, the AI would recognize it. So it makes me more confident about the work. Each day we have more than 20 procedures.
Wow. And what is your personal best? How many polyps you cut during the procedure?
Maximum.
Well, we have done I think more than 15 in one case.
Wow. And the ultrasound, it's also in your practice.
Well, we have a new toy. In fact, you know that conventional transabdominal ultrasound. Nowadays, scope yapalım. We also have that endoscopic ultrasound, meaning that you have ultrasound on the tip of endoscope. So, for especially some secret organs in the body, you can detect and screen them in the best way with that endoscopic ultrasound, and starting with that famous pancreas. You know what? We have even patients that we have cured from pancreatic cancer with that endoscopic ultrasound technology, because through the endoscopic ultrasound we gave radiofrequency thermal ablation to the tumor, and we have patients that we cured from insulinoma. So that's very exciting for us to detect and to cure the patient in the same session. Why don't you see the screen? You see, here is a polyp. Check it.
Wow.
So I am pretty sure that this polyp has potential to form cancer in the future. So what do we need to do? We have to remove this polyp. You see, now it is safe to remove. Snare alayım.
After removing the polyps, do you recommend some special diet, or it's not needed for patients?
No, it's not needed.
Okay.
I tell my patients, international patients, okay, now you can enjoy Turkish kebab in a minute as soon as you get discharged. You see, this is how it's removed. Oldu mu? So check it how you put the clip here, okay? This is the clip. Neşten kapat canım. Biraz açalım. Şimdi kapat. Biraz bekleyelim. Kapatalım. You see, all good. Once it was here, once there's nothing. Yeah, we found out already cancers, unfortunately now in very young ages. So some precancerous polyps. Also, the reflux is very severe in nowadays eating habits. So we have lots of esophagitis, even Barrett esophagus, meaning that they are more prone to lower esophageal cancer in the future. Anyway, we can find them thankfully, and we can cure them as well.
How important the team? How important the experience of team? Because
you know what?
it's very, I see it's very close, and
and they are more even as important as I am here. So this is a teamwork, okay? Not one man show, never ever. Well, in fact, we are in the future now. As I showed you yesterday, now we are using the artificial intelligence during the screening modalities. So we are in the future. But what is the feature of gastroenterology? Feature of gastroenterology is just curing the patients without surgery, so saving patients from surgery. Nowadays, we are making this for reflux, we are making this for even stomach and colon cancers, even some kind of pancreas cancers as well. We can save patients without giving the patient to surgery. And in the future, we will see that we will also be removing gallbladder stones without giving the patient to surgery for cholecystectomy to gallbladder removal. I hope I will live long enough to see that day.